in the old days, if someone needed information from leadership or some other component of the NIH that covered everything in tech transfer from all the institutes, most of the time we would have to go asking each institute that had a system, hey, do you have this? Hey, do you have this? And now it's all in one system. We can pull it up right away and say, here you go.
Welcome to the Transfer Files, inside the world of federal innovation. This is your insider's look at how federal laboratories bring groundbreaking technologies to market. I'm your host, Andrea Nelson. In every episode, we'll bring you insights and expertise from throughout the world of tech transfer. In today's episode, we're sitting down with Tara Kirby, the director of the Office of Technology Transfer at the National Institutes of Health, or NIH. Tara walks us through a groundbreaking project that's revolutionizing the way the NIH manages and shares crucial research data, the Enterprise Technology Transfer System, or ETT. Over 5 years, the NIH consolidated more than 13 million records from 9 separate databases, a massive undertaking, but one that has streamlined processes, improved efficiency, and accelerated the journey that inventions take from the lab to the marketplace. The achievement even won a 2024 FLC Award for Technology Transfer Innovation. Please enjoy my conversation with Tara Kirby. Tara Kirby, thank you so much for joining us.
I'm very glad to be here. Thank you.
So first of all, I'd love to start with your background. Can you tell me what your background is in and how you came into tech transfer?
Sure. I mean, one of the things I love about tech transfer is that people come to it from many different experiences and areas of study. So for me, I was one of the people that came through the scientific route, I guess you'd say. I got my PhD in biophysics from the University of Minnesota and was looking for something to do after that and came to the NIH where I did a postdoc at NIDDK, one of the 27 institutes and centers at NIH. Okay. And so while I was there, I took advantage of all the resources in the area and especially at the NIH to think about what else I could use my scientific background for. And so I knew I was interested in anything that involved communication. So I was looking at potentially science writing, but then I saw this opportunity at the Office of Technology Transfer, coincidentally the same office I'm at now, for a fellow who would be doing primarily marketing. So that's how I started in tech transfer. And about 8 months after that, I got hired to do patenting and licensing work. And time passed, and eventually I started doing work as a supervisor on particularly technologies from the CDC. I moved to the Allergy Infectious Disease Institutes, also at NIH, worked there for a while, and then I guess in fall of 2020, I came back to OTT.
What a time to to do anything, really. But so what was going on at NIH OTT? Which Office of Technology Transfer, just so everybody is on the same page, when you got there in 2020?
It was actually kind of an interesting time. In addition to the pandemic, a few years prior to that, we had undergone a reorganization. There's a lot of different components to tech transfer at the NIH who are very large. I have lots of researchers. So we had previously at OTT managed a lot of different things, including our patents for NIH and licenses. So as part of that reorganization, those activities moved out to the IC tech transfer offices like NCI, National Institute of Allergy and Infectious Disease, and so on. So at that point, we were still sort of in transition because it'd been a little time, but we're still trying to understand exactly, what we were now, what could we become. So I felt like that was a really good time to come in and see what I could add to that.
Absolutely. Because you just mentioned it, tech transfer works a little differently at each of the agencies. And you've got these 27 institutes. So can we just sort of start there? How does tech transfer work for your office?
Yeah, it's a mystery sometimes, especially for people who don't work at NIH, and even sometimes when you do. Essentially, there are 8 IC level, institute and center level tech transfer offices. They basically are in institutes that have large enough programs that they can support enough staff to have an office. For those other institutes who don't, and there are 24 institutes and centers at NIH who have intramural, research. For all those other institutes, they will use the actual offices as service centers.
Okay.
So NCI has many of those because they are already very big, but I think there's 3 other offices that also act as service centers for 1 or more other institutes. So where we come in at OTT is we are sort of the umbrella organization. So we're not like at a higher level, but we kind of address all the things that are on an NIH-wide basis. So that can involve supporting our institute level offices, coordinating activities, and taking care of things that are on behalf of the NIH. So, for example, reporting to NIST.
So from there, from 2020, can you talk about what have been the priorities in the past 3 years and sort of what you're working on now?
Without doubt, our biggest priority for a long time, since before I came to the office, has been to put together a new enterprise technology transfer system, which we call ETT. In the past, we had all the records for our tech transfer activities spread out in the institutes and also at OTT. I think there were 9 different systems that were collecting information. OTT managed all the patents and license information, so that was all together. But everything else was spread out, and not were they only at different ICs, they were using different platforms.
Wow.
So they are all very different from each other. And of course, you can imagine every office does things a little differently.
Mm-hmm. So everyone who was needing to access information was having to cross-reference these 9 databases.
And often they didn't have access to all of those. I mean, almost never. So a lot of the time, people would email a mailing list saying, hey, have you ever worked with X company or done this kind of thing with a CRADA? Because they didn't have that institutional knowledge to draw from, especially if they're small or or new, and maybe the information just not, recorded the way they're used to if they've moved from another institute. So it was definitely challenging. And it was also challenging with respect to doing reporting and other kinds of assessments of how we're doing and our mandated metrics and all those things. So it was a challenge.
So how do you go about, in theory, bringing that together? It is a great idea, but that's a lot of work. How do you go about even starting that?
Well, at the very beginning, there was a needs assessment. We brought on somebody at OTT, and when I say we, I don't mean me, I mean my predecessor. His name is Tim Leahy, and he managed this entire process from beginning to end. And so he brought in contractors who were experts in project management and who could learn about how our business processes work at NIH and OTT. And they talked to many people in the community and to understand what they do, how they do it, boiling it down to the essence of what they need to understand to translate that into a system. Once they had that, we had to go looking for systems that could do that. So we put in a contract in place, competed it out, and it ended up with our vendor, which is Intium. But that wasn't the end.
Oh, tell me more.
You don't. For us, we didn't just buy the system, say, hey, that's great, start using it.
Mm-hmm.
We first had to figure out how to migrate the data from all of those systems, from the old systems into the new ones, which meant understanding the fields that were there, what needed to be transferred. And then in quite a few cases, especially if our OTT system had data and an IC system had data, how do you merge those together and not lose important information? Or if you have companies or other partners that have worked with multiple institutes, they'll have multiple records. How do you merge those together?
Right.
So that was a big challenge. That was not the only one, but that involved us migrating the data in like a multi-stage process that took about a week. It was carefully orchestrated. We tested it multiple times, but we essentially started with a base set of data and loaded on one institute's data, looked at it, loaded on more, and kept doing that until we had everything in the system.
How long did that take?
Well, the actual migration took a week, but it took us months and months of testing, even once we thought we understood what we needed to migrate, to make sure it worked correctly and we weren't losing anything.
Did you need to go through a process of training everyone to work on this new system, getting everyone on the same page?
Yes, that's been part of the process for quite a while when we were developing the system, because in addition to adding the data, we had to make modifications to make sure it matched our practices as a government, agency. We had a group of people, they were part of the user group, subject matter experts in different areas, and they would continually test the system in the earlier stages to make sure it made sense and that they could understand what needed to be done, the functionality was there. So that was an ongoing process, and as we got closer to launch, we did more community training. And that's actually still ongoing today because there's a lot to learn. It's a great system, but there's a lot there.
Absolutely. Have there been, if you would like to share, have there been any growing pains as you've been on that learning curve?
Oh, definitely. It's always hard to use a new system for anybody. And it is very different in most cases from the systems people were using before. The things are just connected differently. You go to different places. It's just a learning curve. But I think one thing that helped a lot is not only the involvement of our user group, but the involvement of our governance group, which was composed of senior people in each of the tech transfer offices that were bringing their systems into ours to make sure that we understood what they needed, that they understood what was happening with the system, that they could communicate to their staff. So I think it went much better than it might have otherwise with that preparation. But yeah, there's still some growing pains. We're still developing SOPs for how we do things now, especially if it's a more complex process. Licensing data, for example, there's a lot of things that go into that we collect. But I think, considering the huge amount of effort and time and change that went into this, I think it's gone amazingly well. I'm very proud of the Tim and all the other folks that worked on this project for so long.
And it's still, because you're still in those early days, maybe we haven't gotten there yet, but have you seen positive outcomes yet already that you can point and say that's because we have ETT?
100%. In the old days, if someone needed information from leadership or some other component of the NIH that covered everything in tech transfer from all the institutes, most of the time we would have to go asking each institute that had a system, hey, do you have this? Hey, do you have this? And now it's all in one system. We can pull it up right away and say, here you go. So it's wonderful, wonderful. And we are looking into ways we can use it for not just our own internal metrics, but how we can also kind of leverage that into more meaningful things that we can use to look at our impact, things that we're doing well, things that we could be improving, and a more full picture of what the NIH is doing in tech transfer.
If there are listeners from other agencies right now who are saying, that sounds like something we need, would you have any words of advice or things that you wish you had thought of or known going into this?
I think the NIH is a little bit unique because we are so big and have so many different components doing tech transfer. Mm-hmm. I know we're not alone, but it is particularly challenging. I would say it's really essential to involve your community to make sure that they have a seat at the table and are able to communicate what's important to them, what's going to help them do their jobs, and what's going to make it really hard to do their jobs. And try to accommodate that if you can. Also be prepared to have a lot of potential changes to make, because in addition to trying to replicate the functionality you had before, if you are going into a new system, you have the capability to do a lot of new things, which is great. But that also means that the users, now that they're comfortable with the system, have lots of ideas. Again, a good thing, but that's a resource that you need to plan for to be able to help do that. And then if you are looking at transferring, from multiple systems, be very careful. Don't assume that you know what's needed, because we found out that there are some things that were not transferred, and we found out later they were important. Fortunately, we are very careful and have all the systems data backed up, so we're able to fix that, but it's much harder to do that after the fact than to find that up front.
Absolutely. And in that vein of increasing transparency, have there been other pieces of that effort beyond this enterprise tech transfer database?
Yes. There are some things that are not directly tied to the system. We had a impact report of our intramural licensing program completed. I think it was completed last year, and that's been really helpful to us. And we are doing a new one for CRADAs this year. But if you look really at things that are directly enabled by this new system, we already have made big improvements to our abstracts and information about our patents and technologies online, much more efficient. We are using that also to connect with other systems like at FLC to get our information about our technologies out there. It's a critical part of licensing your technology. So we're glad we can do that. We're looking at ways that we can pull more information for metrics and things like that. We're also planning on how we can do better and talking about specifically about transparency. How can we get more information about our patent portfolio, about our license portfolio out so that's public and people can look at it? I mean, licensing, there are a lot of things that we can't talk about, but there are things that we can. And I think if people get a good picture of what our overall portfolio looks like, the breadth of what we license, the many, many types of licensees we have, and all the different places we license around the world, I think that's going to be helpful for anyone saying, what the heck are they doing anyway?
Right. And what you've hit on, and it's just a recurring theme with everyone I talk to on the federal side, as well as on the private side, entrepreneurs, that it's a matter of being able to say, here, we have this, or being able to, or for the businesses to say, where can I find this? Or how do I know that this exists? And so that seems to be always some at the root of challenges in tech transfer. So this seems like a big step in that direction.
Yeah, I think so too. And I'm really glad that we have this resource. There's more that we need to do, but just having all the information in one place opens up a lot of possibilities that weren't there before, at least not practically speaking. It also makes it a lot easier to pull data for things like reports we want to provide, whereas before it would have been much too labor intensive. What we're planning with respect to patents is to have an ongoing feed that's updated, hopefully daily. It'll have all of our patents online, and we won't have to do anything once it's set up. It'll all just be automatic. So much less work for us.
And that actually, maybe that's an answer to this question, but now that you have this fresh database and it's all clean and in one place, is there a way to bring AI into the equation to simplify and streamline some things?
That's entirely possible. I mean, to be frank, we have spent so much time just getting our system up and running and doing what it needs to do that we haven't had a lot of time to think about the longer term, applications and possibilities. But I think it would be a mistake not to consider AI. And in fact, my colleague, Steve Ferguson, has been looking into that and recently published a paper about what's being done in tech transfer with AI. So I think especially for things like marketing of projects and looking for potential partners, things like that, I think I can see an immediate application for AI. And in theory, although I haven't tried it myself, we could use that potentially as a tool to help us look at how we can develop new licensing terms that will, serve our purposes and that maybe we aren't aware of, without AI. Other things we'll have to look and see. I mean, we are dealing with a lot of confidential information, business confidential information, so we have to be very careful with that. But I think there's a lot of possibilities there too.
Absolutely. And is there anything that you wish more people knew about your office or what was coming out of OTT or NIH more broadly in a tech transfer sense?
I don't think there's enough time to tell you everything I wish people knew. I think one thing that is not always appreciated is how much expertise and dedication there is when we are working on NIH technologies to get them to the public. We have to be creative because we don't always have markets for our technologies, so licensees are scarce. We usually have early stage technologies, which makes it even harder. And then, we're also trying to work within the government framework, which we need to follow our rules and regulations, but those aren't always compatible with what a company might want. So we have to be very creative in order to both enable that technology to get developed to benefit the public, but also be in line with our values and our policies as a government and as the NIH. But there are so many dedicated professionals there at NIH that I think people don't understand how hard people work and how a lot of the successes we've had are not just due to the foundational groundbreaking research that our investigators are doing, but it's the creative solutions and the hard work of our tech transfer folks as well.
Well, congratulations. That's a huge feat. And thank you so much for being with us today.
Yeah, it was a pleasure. Thank you very much.
You can find more information about Tara, ETT, and much more on the page for this episode on our website, federallabs.org. If you enjoyed this conversation, you might also like episode 6 of this podcast, my conversation with another tech transfer director, Dr. John Kaplan, who leads the technology transfer program at the Department of Veterans Affairs. Thanks for listening. We'll see you back in 2 weeks on Transfer Files Tuesday. Thanks for tuning in to the Transfer Files, your insider's look at federal tech transfer. Don't forget to like, subscribe, and stay connected for more episodes exploring how hundreds of government laboratories and countless industry partners are driving innovations that shape our lives.